The COVID-19 pandemic has impacted many sectors, groups, and communities in ways that are not always easily or immediately detected. A recent study commissioned in Jamaica by the United Nations Development Programme (UNDP) and conducted by CAPRI and SALISES has provided the first comprehensive assessment and definitive record of impact and coping measures utilized to manage the pandemic in Jamaica. The study measured 1. The socioeconomic impact on the economy, health, education, social protection, national security, environment, and agriculture, and 2. The vulnerability of local population groups, scoring and ranking their vulnerability using UNDP's Multidimensional Vulnerability Index (MVI). The result is a socioeconomic impact assessment measuring COVID-19 impact 1 year after the first cases were identified in Jamaica. 3,194 persons were interviewed and a number of other impact studies conducted by other groups examined. The UNDP's MVI, used for the first time on any study in Jamaica, ranked vulnerability based on 12 indicators. These included COVID-19 test status, access to health centers, disability, mental health, well-being, food consumption, food quality, school attendance, employment status, income, social protection, and assistance from friends or family. The MVI found that 2 out of 3 Jamaicans scored a negative impact in at least 4 of the 12 indicators measured. Overall, respondents were most vulnerable in mental health, social protection, and assistance from friends and family. 57% of people surveyed said the COVID-19 pandemic has taken a toll on their mental health as they felt more depressed, worried, anxious, or stressed. The data showed that the parishes most vulnerable to the negative impact of COVID-19 are St. Mary, Manchester, and St. Anne. The parishes with the fewest vulnerable respondents are St. Thomas, Trelawney, and Westmoreland. The main differences between St. Mary, the most vulnerable parish, and Trelawney, the least vulnerable parish, are in access to health centers, income, food quality, and social protection. The data showed that 70% of individuals in urban areas are vulnerable, while only 63% of those in the rural areas are. Respondents earning between $200,000 and just under $300,000 per month were identified as the ones who were most vulnerable. The 3,194 interviews, combined with the analysis of secondary data, revealed impact on several sectors. The Jamaican economy contracted by 20%. Over 150,000 jobs were lost, and nearly half of businesses reported a reduction in sales. Almost a quarter said their supplies were disrupted. Businesses in rural areas reported the largest declines in revenue. The hardest hit groups in the labor market are those employed in accommodation, transportation, entertainment, and recreation. Income loss soared across the board. When asked about support that would be needed to help to reduce the impact of the pandemic, practically half of respondents said they needed more food. Others said money, masks and sanitizers, health insurance, internet access, and educational resources. The study confirmed a high level of vaccine hesitancy, with only 33.9% indicating that they would take the vaccine. The Socioeconomic Impact Assessment Study recommends a wealth of policy options for reducing risk of the most vulnerable sectors and populations in Jamaica as the country strives to fulfill the United Nations Sustainable Development Goals and achieve Vision 2030. You can access all findings and policy options in the full publication, available at www.jm.undp.org.